Hey everyone, my name is Brianka Larkin and welcome to my portfolio project presentation. The subject of this presentation is end of life care. Excuse me. When I was trying to figure out who would be a good candidate to do this project on, I instantly knew the right patient. So this patient name is AL. She's a 68-year-old black female. Just a little quick background on me and Mrs. AL's interaction. She actually was my first patient that I ever did an initial assessment and visit on as a student nurse practitioner. Um, and what made her the perfect candidate is at that first visit that I ever had as a nurse practitioner student. Um, my preceptor was actually present during that initial visit. She just kind of wanted to get a feel of what I knew. And I was so nervous and just, not feeling like I wasn't in my element. And I guess Mrs. AL could sense that. In the middle of me trying to do my assessment, she made this joke that was just so hilarious. And I can't remember what the joke was, but it was hilarious. We all just died laughing. And after that, it just really put me at ease. Um, and so I have been with my preceptor, this same preceptor from the beginning, from the start of this program. So I have become very fond of Mrs. AL. She is I knew she would be a good candidate because she has a wonderful personality. She has loads of wisdom. Me and her have become very fond of each other. Um, she has kind of went through, life things during my time at clinic with her. She's had a lot of transitions going on. Her health has declined and got back up, but I just knew I felt comfortable with her, and I knew she felt very comfortable with me. And I knew that she would be a good candidate because of some of the things that she had going on in life. Um, just a little bit background on Mrs. AL. Like I said, she's a 68-year-old black female. At the initial visit for this project, she had came in for a 3-month follow-up in a medication refill. Also at this visit, she had complained of having some muscle spasms. So we addressed all those issues at the visit. She has a history of hypertension, diabetes, type 2, hyperlipidemia, and now muscle spasms. Doesn't have any surgeries or hospitalizations. Mrs. AL is a widow. Her husband died in 2020 from COVID at age 72. She has 2 living children, a daughter who's 40, who is a chef, and a son who's 48, who is a mayor and an entrepreneur. Mrs. AL is a retired principal. She's a motivational speaker. She's an author. She's a caretaker. She takes care of her elderly mother. And she's also a CEO of a nonprofit organization for teenage mothers. She lives with her mother that she takes care of and her dogs. She can perform all of her ADL independently. She says she does drive, and she also feels safe at home. She tutors math and English to high school students. She teaches piano, and for exercise, she told me she does yoga with her friends 3 days a week and swim at her local gym. She denies being depressed or having any mental health issues. She says she has no more stress than the average person. She denies smoking tobacco. She says she drinks champagne on celebratory occasions, and she denies using illegal drugs. At this visit, she was well developed, well nourished, no acute distress, and nothing was abnormal. So, before going in and talking with Miss AL, I first wanted to get my blessings from my preceptor, and I wanted to let her kind of know what my project was and kind of what was going on. And of course, she definitely gave me her blessing, told me she did not mind me having a discussion with her patient. I wanted to get her opinion on if she thought that me having this discussion with Mrs. A.L. being that she lost her husband so unexpectedly a couple of years ago, and just me kind of knowing about her grief process and being there for a couple of visits when she had a couple of breakdowns, would it be appropriate? Um, and I want to kind of just, discuss how I was kind of feeling with her and just see, get her perspective on it. So just talking to her, I didn't. I was more concerned with how the discussion would go for Mrs. A.L. I knew she definitely is an open person. She has a wonderful personality. She's an open book. She doesn't mind talking to you and telling you how she feels, and she's very in tune with her feelings. But when it comes to the situation with her husband, I just, didn't really know how to feel. I was more concerned with her and her feelings and not taking her back into that grief state. But my preceptor assured me that this is something that everybody should put in words and get it taken care of, because things does happen and people do transition and die, and you don't want to leave that burden on your family. And I, you know, felt that me and Mrs. A.L. were acquainted enough and we felt very comfortable with each other that she wouldn't have a problem with the discussion, or that she would be okay with me talking to her about it. And my preceptor agreed. So I kind of talked to her, I got all my nerves out talking to my preceptor, and then I went in to have the discussion with Mrs. A.L. So actually, the clinic that I'm precepting at, they actually have the 5 wishes tools. They incorporate that into their paperwork that they do with some patients or whatever. And so I took one of the 5 wishes tool paperwork assessment that they have in with me when I went to discuss this process with Mrs. A.L. So, of course, I went in. I greeted Mrs. A.L. I introduced myself, and I asked her how she was doing. And she said she was doing well. And she asked about me and how was I doing. I asked her, would she be up to discussing end of life care, advanced directives? Has she ever heard about it? Does she have a living will in place? Does she have a power of attorney? And she actually said yes, she's definitely open to discussing it. And she actually, not too long ago, was discussing it with her family and friends at a function. They had a discussion about their end of life wishes, but they didn't have anything down in writing. So I told her that I hope that this discussion that we were having today would allow her to get her wishes on paper, so that her wishes would be known to her family whenever she, gets to that point in her life. So she told me she hasn't had a chance to actually sit down and have a conversation with her kids about her end of life wishes, but she do want to, especially when her husband transitioned. They didn't have anything in place during that difficult time, and it was very difficult trying to get things together. So I told her that at any time during the process, if the questions became too difficult or she wanted to end the conversation, she just let me know, and we will pick up at another time whenever she's able to. So the first question I asked her was, if she was unable to make health decisions for herself, who would she like to make those decisions for her? And she told me that her wishes are for her 2 children to be able to come together and agree upon the decisions for her. But if they can't come to an agreement together, then she would like her son to have the ultimate last say so. because she know that he would have her best wishes at heart, and know that it wouldn't be a personal decision that he's making for himself and his sister. Um, so her son would be her proxy. Um, no family members were present at this visit or during this conversation, and there wasn't any barriers during this conversation. She spoke freely. She spoke from her heart, and the discussion just really just flowed. Also, we did use the 5 wishes tools assessment that the clinic had in place to kind of guide the discussions, and she did write down her answers during the process. Um, she didn't have it priorly completed. We completed it during the process. Um, so the next question I asked was, what kind of medical treatment did she want or did not want if she became sick and she couldn't speak for herself? She said to start, she wanted to be treated with dignity throughout the whole process. She said she didn't want to suffer or be in any pain. She said she wanted to be comfortable and clean, like she lived, like the life she lived. She said she wanted to be offered fluids, if possible. She said that if she could not walk to the bathroom physically, she didn't mind wearing diapers if she needed to, or briefs if she needed to. She didn't want the doctors to delay her care if there was no way that she could live an adequate life. She said that she didn't want to be brought back to life, and she didn't want to be on any type of life support. I asked her what did life support treatments mean to her. She said to her, life support treatment is when devices are used to help keep her alive or keep someone alive, or when CPR is done to resuscitate her. She said for her end of life care, and if there is no hope of her getting any better or having a good quality of life, then she didn't want any type of life-saving measurements or be on any type of life support. I asked her how comfortable do she want to be in her end of life care. She said she don't want to be in any type of pain. She would like to be given the appropriate medications to ensure that she's in no type of pain. She said she if she was unable to keep up her hygiene, she would like to have a bath every day like she did. She wanted to be well kept. She wanted her lips to be moist. She wanted her hair to be nice, as if she was in her right mind and taking care of herself at home, because she loves to go to the beauty parlor. She said she also wants her nails painted. She said she wanted fresh linens on her bed. She said she want her favorite gospel channel playing in the background. And she wanted to make sure that her family are aware of all the options. She wanted her family to be in the know of what is going on and what to prepare for. I asked her how would you like people to treat you at the end of your life, or during the process of your end of life care. She said to start, she wanted to have pictures of her family all around her bed. She wanted her favorite music to be playing. She wanted to transition at home, if possible. She wanted her family to be by her side if she take her last breath, especially her kids. But if they were not in the right state of mind, she didn't want to force them to, and she understood. She said she wished to be treated with kindness and dignity, and she wanted to be prayed for by her pastor. She said she would like to have someone with her as she's transitioning, someone she loves as if her kids. But she didn't want to be a burden on anyone. I asked her, is there anything that she wanted her loved ones to know during the process? She said, I would like my children to know that I love them. She said she would like everyone to make peace with everyone. She said she wanted her family to know that she lived a great life and she went to be with their Father in heaven with her Father, Jesus Christ. She said she did not die in fear, and she wanted her family to know she did not die in fear. She said she wanted um, her family to remember the person she was before she got sick. She said if her family struggled with her death, she wants them to seek therapy or to seek counseling or to talk to their preacher. She said that after her death, she would like to be buried at their family gravesite. She said at her memorial service, she would like her favorite songs to be played. She would like poems from each of her kids to be read at her service. She said she wanted her memorial service to be a celebration of life. She said it's not a sad occasion. She said she wanted, if possible, she is an organ donor, so donate her organs to someone who can use them, and she wanted to her family to keep her spirit alive. Um, and so that was the end of our questioning process. Um, we did talk about we did provide her information about living wills and advance directives and power of attorney. The clinic that I'm in, they have information and print off and booklets about those processes, about how you obtain a living will, how you obtain an advance directive, where they're restored, who keeps those, things of that nature. She said she does not want to be. She wants at the end of her life, if there's no quality of life, she does not want to be. She does not want CPR to be done. She does not want to be intubated. She does not want to be on dialysis. No blood transfusion. No type of artificial nutrition other than fluids. No surgeries. No hospitalization. She would like to die. She would like to transition at home. No diagnostic tests. No medication. Other than comfort measures medication. No defibrillators or converters. Um, she also at the end of the conversation we had, I thanked her for sharing her inner life wishes with me. I told her how inspired I was by the conversation, because I haven't had that conversation with my own family, my own mother, my own husband. And since having this conversation with her, I definitely want to get this in place with my own family. And I thanked her, and I told her it took a lot of courage of her to talk with me about these decisions, and I thanked her, and she thanked me for getting this process started for her. And I told her I was glad to assist her anyway. We also did talk. I explained to her about the palliative performance scale. I told her it's a tool that's used for measuring the progressive decline of a palliative resident. It has 5 functional dimensions. It looks at ambulation, activity level, evidence of disease, self-care, oral intake, and level of consciousness. Um, it It informs decisions about a patient's hospice eligibility by helping clinicians recognize the patient's functional decline. So I really enjoyed this project. AL was a wonderful candidate. She was very open, and I hope y'all enjoyed listening to my project. Thank you.